Good afternoon. My name is Samantha Marshall, Associate Director of Alumni Engagement for the University of Toledo Alumni Association. We welcome and thank you for joining us this afternoon for a lively conversation with UToledo faculty members, Dr. Kim Nielsen and Dr. Monita Mungo. Before we begin, I would like to share a few housekeeping notes for today's conversation. Attendee names are not visible to other attendees. You will only see your name in the attendee list. Please note that all attendees are muted and cameras have been turned off. Throughout today's conversation, please feel free to use the chat box and the Q&A box to ask any questions that you might have. It is now my pleasure to introduce to you Associate Dean and Professor in the College of Arts and Letters, Dan Hamill, who will get us started and introduce today's presenters. Dan?
Thanks very much, Sam. Well, I'd like to start by welcoming all of our alumni and the friends of our college to the presentation today, which I'm looking forward to very much, and sort of cut to the chase to give Kim and Monita as much time to do their presentation and all of you as much time to pose questions as we possibly can. So let me start by introducing Kim Nielsen, who I believe will be speaking first today. Kim is a historian and a disability studies scholar. She is a professor of disability studies at the University of Toledo. And I think her scholarship has been characterized by a commitment to documenting and telling the stories of disabled and other marginalized people. Kim's newest book, Money, Marriage, and Madness, The Life of Anna Ott, will appear this summer, I think has appeared. It's by the University of Illinois Press. Other books include, and she has multiple books, by the way, but other books include the Oxford Handbook of Disability History, which came out she co-edited, came out in 2018, A Disability History of the United States, which came out in 2012, Beyond the Miracle Worker, The Remarkable Life of Anne Sullivan Macy and Her Extraordinary Friendship with Helen Keller, which was from 2009, in The Radical Lives of Helen Keller, which is in 2004. She's won numerous awards, including several here at the University of Toledo, but those awards include 2 Fulbright appointments, the 2007 A. Elizabeth Taylor Prize of the Southern Association of Women Historians. She's had numerous teaching recognitions and a National Endowment for the Humanities Fellowship. At the University of Toledo, she teaches courses on disability history, eugenics, law, and gender. So now let me turn to Monita Mungo. Dr. Mungo is a first-generation college student whose love for humanity and social justice developed during her academic journey. That love sort of demonstrated itself in various forms through center management, academic program creation, course development, department and community service, social activism, and research. Her primary goal is to educate students so that they're capable and willing to improve the human condition, to stimulate the local economy and create opportunities for future generations. Dr. Mungo is an assistant professor in the Department of Sociology and Anthropology here at the university, and she works diligently to expose social inequities and demonstrate how this treatment serves as a barrier to educational achievement. She also serves as an affiliated faculty member in the Africana Studies program and the Department of Women's and Gender Studies. In addition to her scholarship, as it might be evident from that introduction, Dr. Mungo is developing sort of a public face to her scholarship as well. And I think it was just about a month ago she had a very fascinating article appear in The Hill, among other places that she has published publicly. So with that, I will turn it over to Kim. I believe you're the one that is speaking first, and we'll get started with our presentation.
Well, good afternoon, everybody, and thank you for joining us on this very hot day. I hope you are all well watered and in a cool space. I'm really proud of our college, the College of Arts and Letters, and the students that we have, the alumni that we have, and I'm thankful for all you do. For me, the seeds of the project of which Dr. Mungo and I are going to speak began during the Toledo water crisis of 2014. I was relatively new to the region, and the experience shook me. I was struck by the ways in which different people experienced the water crisis differently, their stories based on race, class, geographic lines, disability health status, and I wanted to keep the stories. My questions, however, and my commitment, I will admit, got lost in the daily routine of so much to do. And now has come the pandemic. And I'm going to read a brief excerpt to you of an essay I have forthcoming on experiences of teaching during the pandemic. My students and I emerged from the spring 2021 semester with an urgent desire that our stories not be lost. Time should not erase the injustice, the courage, the pain, the boredom, and all of our pet stories from the pandemic. Nor should we allow those eager to gloss over its consequences to do so. What temporarily became our norm is horrific and must not be erased. So a few of those stories. Necessitated by home overflowing with family members and enabled by parking lot Wi-Fi, one of my students spent the pandemic, including the winter months, taking classes from her car. I taught about how hospitals make decisions, sometimes with great forethought, sometimes horribly, but make decisions about which COVID patients get access to ventilators. This was only a month after my brother died of COVID, and for the first time in my career, I cried while teaching. One of my students ordinarily lived with her grandparents, caring for them, but moved out after one of them had been exposed. She then brought food to their doorstep nearly every day for a month, while working, completing schoolwork, and borrowing a friend's couch and kitchen. Another student, wrestling with intense anxiety, attended every virtual class period with his cat on his lap. Another always kept her camera off, ashamed of her crowded apartment and the poverty it made visible. I shared information on local food banks every few weeks, and students updated each other on which bank had what food available. Two of my students agonized with great worry over the survival of family members in global regions with few medical resources. None of our classroom community died, but one recovered from COVID with cognitive impacts that made it impossible for her to finish the semester. And like many teachers, an unusually high number of my students simply disappeared. And then there were experiences like this, when one day a student joined our classroom, our virtual classroom, from the McDonald's drive-through line. And we had an impromptu and laughter-filled discussion about our favorite breakfast foods. And these are the stories I think we need to keep. But it's too easy to dismiss these experiences as unique to the pandemic. By doing so, we ignore our responsibility and erase reality. The power structures that the pandemic laid bare and were brought to the surface by our public conversations about racism. The power structures exaggerated by remote learning already existed. Economic inequalities, disparate access to healthcare, social isolation, racism, the brutal consequences of the disregard for disabled people remain present. My hope, and our hope with this research project, is that what was once not apparent to most people, but then boiled to the surface due to the pandemic, can remain apparent so that we, all of us as educators, as citizens, as voters, and as Cal alumni, can address injustices and exclusions. I think that if we return to normal, we do ourselves a disservice. So Dr. Mungo and I are committed to collecting the stories of Toledo's experiences and all of the data during the pandemic. We want to focus on marginalized communities. Our purpose is to document, but then go on to use that data to aid national and regional conversations with leaders about how they seek to ensure the social health, economic health, physical, mental health of all of us and those who live in the region. Dr. Mungo and I are also really, I say personally and painfully aware that there's a really critical and immediate need to sustain our students. National and UToledo data indicates that the devastation wrought by the pandemic has derailed the educational dreams of many thousands of students across the nation. And mostly students from marginalized communities, particularly first-generation college students. And these are dreams to make their lives better, their family lives better, and these dreams have been derailed. Well, we cannot rescue all of these students. Dr. Mungo and I believe that we can rescue some. And we want to do so by integrating a small number of such students into this research project. In our minds, this is practicing what we preach. These students will serve as 1 or 2 year research assistants, gaining course credit, helping us design the research project, and we hope to receive immense professional development experiences that will enable them in their careers as they move past the University of Toledo. We will give them a significant stipend to enable them to stay in college. So with our data in this research project, we hope to make large-scale proactive change. But by engaging student researchers, we want to make individual and family level proactive change. Dr. Mungo.
So Dr. Nielsen mentioned teaching during the pandemic, and as she shared so eloquently all of the summaries of stories that she experienced, it was extremely hard teaching through the pandemic. So not only were we trying to impart whatever knowledge or expertise we had, it was also pulling them through the classroom every day, every week, to make sure that they showed up. Whether they learned or not, I can't guarantee, but the fact that I could have some sort of contact with them to ensure their well-being. There were guidelines for if they caught the virus, but there were no guidelines for us to follow for their mental health, right? And so this research, we want to be able to, like Dr. Nielsen said, get the stories. We want to document the lived experiences of our students in the communities in which they come from, in the communities in which we teach and in which we live throughout the pandemic. Our research serves to give a bigger picture to the statistical representation of the social inequality in which we all experienced. So I'm going to talk about methodology now, or just teaching right now?
Yeah,
Methodology. Okay. So as Dr. Nielsen mentioned, so what makes this research we think extremely unique is that we are combining 2 of our expertise. So she's the oral historian, and so she will collect the stories, and then I will add the quantitative dimension to it so that we can have a very contextual understanding of how community members experience the pandemic, right? And so we will collect a survey. Well, first, before that, we will provide the students who want to be involved in this research a part in the research, so a stake, more so than just collecting data. We are going to use a social science method called participatory action research, in which they actually have a voice, so that they can tell us their stories, but then say, who should we reach out to in the community and in their particular community, right? So whether they're a member of a religious organization, a community organization, the local food banks that they visited every week, right? So we want to be able to collect those stories, and we want to be able to change the balance of how research typically works, so that the students have a voice in helping to not only design the research, but as well as collect the data and help us to analyze the data, and then eventually they will produce a product of their own in addition to helping us with our products. We plan to, like I said, collect surveys, do an oral history, and then contextualize the lived experiences along the lines of social determinants of health. And so we specifically want to get data that talks about the ways in which people, were born, live, work, access grocery stores, access community health organizations, hospitals. So all of the ways in which people live and grow and age and eventually die in their community. So we want to know the context for which they experience the pandemic, because the way that I experienced the pandemic is going to be different from the way that Dr. Nielsen experienced the pandemic, which is definitely going to be different than how our students experience the pandemic. And so we want to provide those lived experiences so that ultimately the people and the powers that be who make the policies and the guidelines for how we work to try to keep ourselves safe during the pandemic, we're able to give them a better way to create that policy and a better lens to create policy that looks out for everyone. Because as we knew, before the pandemic, social inequality existed, but it became it was more enlightened during that it was more highlighted, I should say, during the pandemic, because of the ways in which the pandemic was experienced as a result of these social determinants of health, right? And so things like race and age and ability status and gender and gender identity and gender expression, right? So all of those things contributed to someone's susceptibility to attract or getting the virus. And so we want to be able to document that, and we think it's important to document that. So then the powers that be, those who work to keep us safe, have a better and a more nuanced understanding at how their policies and guidelines impact the least of our community in our community, right? Because I believe what we saw in our classrooms and in the news and in our communities are those stories, and they weren't new. We want to highlight those stories.
Thank you. We look forward to talking with those of you out there in the audience about this project that we're engaging on.
Yes, absolutely.
Actually, as the chat questions come in, and I think Samantha is going to let us know about those, maybe I could just ask a couple of questions if you don't mind. I guess a couple things come to mind, but I'm curious to how you're going to try to recruit students and how you're going to try to find students. Is this something that you see as limited to students that are actually in your classes, in your respective majors? And then once you find the students, sort of specifically, what are they going to be doing as part of the research?
You want to start with that?
Sure. So our recruiting methods will be, of course, asking the students that are in our respective departments as well as our college. And then if we don't, reach our number, obviously we would go out of our college, but our goal is to stay within our college. And I think we have lots of budding social scientists that would be interested in this type of work. But once we recruit our students, the first thing we'll do is start out with a focus group of those students and dive into the participatory action part of our methodology to find out what types of questions we should ask. Our general overarching question will be around, how did your life change during the pandemic? How did your life, what was your life like? I guess during the pandemic is probably a better way of saying that. But then asking the students, who are the people that we should talk to in the various ways, in the various communities in which they reside and participate in, and however they define community, right? And then to come up with what is their final outcome, the product that they want to have from this research, apart from what Dr. Nielsen and I will do, what is their outcome? So part of our methodology is not only having them participate as a research assistants, but also having a voice in the research as well. And so once we get that, then they will help us to collect the data, analyze the data, and then again, figure out what that product is, whether it's an article, a poster presentation, definitely joining us in presenting our research at regional conferences.
We're also hoping that this may be altered according to the career goals of each student. Mm-hmm. And we'll have to see what those are. But I think certainly, students who are interested in writing or research or public activism, whatever those interests are, I think that we can shape their engagement with the project and their end result with their own interests.
And can I ask as well, and this is, I apologize if this is a bit of a snoozer of a question, but I am a social scientist, so I do get really sort of interested in some of these methodological things. but both of you, I mean, both of you talked about some of your experiences in the pandemic. Are you going to join in the sort of the participatory research, or are you going to be guiding the students through that process?
We've actually talked about this. I think we are going to join, but I think it has to be a delicate balance, because for participatory action, right, we can either be the driver of the bus or we can be a passenger. And I want us to delicately go back and forth, because inherent is the power of us being faculty members and then students. And so in efforts to make sure that the student voice is heard and utilized throughout, it has to be a delicate balance. So we will be dancing the whole time.
And to maybe keep on this a little bit, what's, and I think this is sort of clear, but what's the action side of this? I understand the participatory side, because the students are sort of participating as their own research subjects, I guess, in a way. But sort of what do you have planned for the action side, or what is the goal in terms of work that might be done with policy or with any kind of sort of proactive agenda in terms of making social change?
Well, I think that first of all, we simply need to know what happened and how different communities, different geographies, different constituencies have been impacted and continue to experience the pandemic. So we need basic data. And that is emerging slowly across the nation, but also in inconsistent ways. So we need data. Then, we hope to in essence, unearth and think further about what members of our community have been underserved, which needs are not being met, what are the lingering aspects of the pandemic. We were laughing the other day because we started this last spring, and clearly both of us in our original formation of the project thought it would be over within a few months, and little did we know. So I think there's still a lot of unknown about the future, but we're hoping that with data we'll be able to show unmet needs in the community, develop ideas about what communities need more assistance, what communities need more engagement in decision making, and which constituencies need to be in conversation with one another as we think about going forward.
And so the action part, like she said, is developing the data, and then using or analyzing, collecting and analyzing the data, and then using it as a way to suggest policy for future pandemics or future health crisis, right? So, like, for example, use the CDC guidelines for making masks at the very beginning, and it said, you can use a bandana, right? Well, using a bandana did not land correctly in all communities, right? So for people of color, especially men of color, making a bandana and walking into a public store, there was another issue, right? And so using the data, being able to suggest policy in different community, saying to the policymakers, when you create a policy for, public health, you have to think about all the public, not just the general public, right? And so that would be the action part, okay, so now that you know what you know, and this is what the data is telling you, what are the suggestions that you would give to the local community, the national community, for keeping you safe?
You've already sort of addressed this, I think, but maybe more specifically. And what do you hope the students get out of this? Obviously, if you've got 10 or 15 or 20 different students, they're going to get 10 or 15 or 20 different things out of it. But in terms of specific goals, what are the kind of outcomes you would love to see for the students?
Well, I think in general, as educators, and I think I can speak for both of us, that we believe in education, and we believe it is a way to better students' futures and the futures of their families. So, that's a really broad goal, but we hope they get relationships with us out of that, because we know nationally that when students have relationships with professors on campus, they're far more likely to stay and succeed and graduate. So we hope for that. We want them to have incredible professional training of gathering research, presenting information, presenting it in an accessible and clear way, of making presentations, talking with community leaders, talking with multiple kinds of communities. That is a skill that someone in nearly any profession will benefit from. And we want to give students those experiences and that practice. And, let's be honest, the opportunity to make some mistakes, because that's the best way we learn. We're hoping that they will make contacts in the community, both with community leaders, state leaders, regional leaders, as well as with general folks in the community that those students can then use as they become professionals and go forward. We've also know that students do not exist as islands. Our hope is that by enabling them to continue their education, their families will also be impacted in a multi-generational way. And we hope they have
Right, absolutely.
Yeah.
I should be clear, if anyone of our audience members have questions, please feel free to type them into there's a Q&A response there, so you can do that. But I will keep going because I have bunches, but I don't want to take up anybody else's opportunity to ask a question. Kim, you said something that just struck me as being, excuse me for saying this, just such a historian thing to say, and which I really appreciate, because as a social scientist, I have a tendency to leap ahead. There are things I think we already know. And when I have worked with historians in the past, I've been told, we don't know that yet. And I think that's an interesting point. We need to have the data. We need to know the stories. I'm just sort of curious, and you shared some, but what kinds of things, and Monita, this is a fair question for you, but it's horribly unfair to ask a historian. What kinds of things do you think you're going to hear that may, if not surprise people, at least make sort of members of the general public reflect a little bit more on what we've just been through, and perhaps what we may go through a little bit more of in the not too distant future?
Yeah, so again, I'm a historian, and that is what I love. And I think that by learning about people's lives, we can learn a lot about large structures and what was going on. I would love to know how people accessed food during the pandemic and how that changed from before the pandemic, because I think it changed dramatically. People's living situations, who they lived with, how many people were in their houses, how they paid for those places of residence, how they then made families and relationships work. I have to admit that one of the things my students talk about frequently, is they talk about the basics of food and housing and safety and securing that, but they also talked about how in the world do you flirt and maintain relationships during the pandemic. And I think those stories are equally important and can tell us a lot about class and race and gender identity, safety during the pandemic. I would like to know about accessing healthcare, about how they got their information. I would like to know about hair care practices during the pandemic. And for the first time, I had my offspring cut my hair several times in a row, which I'm not sure if I'll ever dare do again. But I think that all of us experience this in different ways, and that shows our family relationships. It shows the cash available to us, our sense of safety, our lack of safety. So I, as a historian, would love questions both really big and profound, how much cash did you have available, and, where was it tight or not? But also the questions about food and baking and pets and hair and family relationships and love and caring for people you love far away while never being able to see them. Those are stories that really matter.
So the things that I think so from the social science perspective, right? We already know that inequality existed, right? But I think what we will be surprised to find out is the ways in which we handled that inequality, right? So the whole phrase of essential worker, and the 7 o'clock banging of the pans and the celebrating them. Lots of fundraisers were going on to celebrate the essential workers. But I think what what was lost on many people were that many of those essential workers outside of the, well-paid doctors and nurses and, were the janitors and the truck drivers and the grocery store clerks and stockers and cleaners, right? So all the people who had sketchy healthcare access, who had, sketchy benefits, who were underpaid or low, paid had low wages. Those people were still considered, who were considered essential, were also the low skilled before the pandemic. And so we got this beautiful, word to make it sound better. But I think we will be surprised to see it the ways in which they really, really struggled, right? When you think about how unemployment benefits panned out, people made way more money being on unemployment than they did actually going to a job, right? And so as opposed to when they could go back, the rhetoric around people being lazy as opposed to people maximizing their monthly wage, right? So I think we was, as social scientists, we know what's happening, but I think the general public will be surprised at the ways in which inequality was characterized as this bad and this negative thing. I mean, it is bad, it is negative, but the lived experiences and the ways that people coped and the strategies that people had to make it and to survive, and not only survive but thrive, I think they'll be surprised about those strategies. I feel like we'll find some very creative strategies of what people did to thrive and to find their happy spaces throughout the pandemic. And even now, as the rhetoric of us opening, we're opening, we're getting back to normal, right? But we're not. But it makes us feel better to say that. But the ways in which society is still experiencing the effects of the pandemic, I think we'll be very shocked to see the ways in which people have created, like I said, these strategies to be happy and to survive.
And I think we'll learn a lot about community sustenance. That is important to know. Everything from the ways in which extended families, both sort of real and fictive kin, work together to provide childcare for each other, to provide food access for each other, to provide religious care for each other. I think those forms of sustenance are really important to document and then to build on as we go forward to care for communities.
Actually, I think we have a question in the question and answer. I don't know, Samantha, did you want to deal with that, or I can? It's a little small on my computer, but I think I can read it if you would like me to do so.
Sure.
Okay. Actually, this is from one of our advisors, Erin Cerniak, actually, who was a little bit late because she was actually working with students in rocket launch, which is a very important activity for us right now. But she does advise a lot of the first year social science students, and interdisciplinary students, and she was sort of wondering, is this something that faculty advisors and others, it would be appropriate to discuss with them? And is that a way of potentially sort of recruiting students? In other words, I think she wants to know if she can help you out a little bit here.
We'll take all the help we can
Yes,
get.
absolutely.
And, certainly, ultimately also we need the funding for this project.
Right.
And we're not able to do the support for students that we want to without the funding. But yes, as we get the funding, when we get the funding, I'm going to speak optimistically. Yes. We will need advisors on campus to help us with sharing this information and identifying and recruiting students who'd be appropriate and for whom we would be appropriate.
Well, if I can, let me turn that question again toward our audience. I mean, what is it that perhaps alums and friends of the college might be able to do for you here?
Well, one, if I can be really crass, we do need the money to support this project. And that is to find participants, to provide very small stipends for those who engage in interviews and survey data, to provide scholarships and for our students. That is the big expenditure. But also, we would very much appreciate Cal alumni being engaged by helping us connect with organizations, community, nonprofit, religious networks that you have in the community that would help us to access members of marginalized communities in the Toledo region. And if you have questions, that you believe would be worth us exploring in the community, we'd love to hear that. Okay.
Well, let me ask then, how we've focused a fair bit on the students, but your plan is then to broaden this research into other elements of the community and to sort of get information to talk to folks that are in social services, in all sorts of other activities. Sort of, if you might talk a little bit more about that aspect of the research, that might be helpful.
Well, in our interview and survey data gathering, we, I think, are really adamant, we don't simply want to speak with, say, leaders in social service agencies. We'd like to speak with the people that those agencies serve. And, I think TARDA directors, for example, are very important, but the drivers and the riders are also really important to have conversations with. So we will need, assistance in not just identifying leaders, but helping getting access to the folks in the community who are just trying to make it through their daily life. And those are the folks that we really want to talk with. This is not a research project about community leaders. Those are not our primary targets. We want to speak with members of marginalized communities of the Toledo area and have conversations with them about their pandemic experiences and survival strategies. I keep thinking back to one student I had, a young man who did his classes while daily supervising the homeschooling of 5 nieces and nephews so that his parents and his siblings could do wage work as essential workers. And he was trying to go to school full time while having these little, very cute kids running around him and asking, questions and occasionally telling us about their potty experiences on audio. But those are really important things to know. And, it is him that I would like to interview and his family members about what family and economics and race and class meant during the pandemic and how they cared for one another and how they struggled. And I'm on a soapbox, so stop me.
No, you're doing great. Our project is more about the lived experiences of, and I'm going to say this in quotes, but the regular citizen, right? So that our recommendations for policy will be based off of the ordinary citizens and lived experiences, not, aggregate data of, I don't know, the high class or middle class or upper class, middle class, professional worker. We want the lived experiences, because policies and recommendations have to be able to, help all people. And I think we witnessed that during the height of the pandemic. All policies and regulations were not for everyone. Everyone could not quarantine safely. Everyone could not, stay at home. Everyone could not, teach virtually or learn virtually, right? And so we need to, the pandemic showed a need for better policy recommendations. And so we want to be able to contribute to that. And so in order to do that, our data has to come from the people for which we are trying to help.
I think I want to ask one last question, and I think we can maybe wrap it up after that if we don't have any more questions from our audience. And this is just my bias showing. And my bias is that I'm interested in how Toledo is different, and places like Toledo are different than places that often generate a lot of news. So in the context of Toledo, while certainly you're going to see similarities between the stories in Toledo and the stories in Los Angeles and the stories in Tampa or whatever, I'm just sort of curious if you've given any thought to how the pandemic and sort of the lived experiences of the folks that are carrying out groceries, that are preparing food and so on for us, might have been a little different here than they were in other places. And I'm a geographer, so I tend to think about that. And the answer quite well may well be they weren't that different. But I'm sort of curious if that had entered into any of your thinking about this.
Well, I think that, so in my experience and the intellectual, I guess, knowledge that I have, Toledo's both unique and incredibly representative of the rest of the nation, like perhaps all places, right? We have our uniquenesses and representation. We are geographically segregated amongst class and race largely in the city of Toledo, and that is representative of the nation. We have class differences, we have class segregation, we have race segregation, we have a community of disabled people who are often overly dependent on, are overly representative, they overly have to use public transportation, and yet we don't have really great public transportation in the city of Toledo, the region of Lucas County. Well, everybody's working on that. So I think there's ways in which we're very much representative of the nation. There's ways in which we're very unique. We have individual characters, individual neighborhoods, individual histories to the neighborhoods and the people. We have, obviously, one thing the pandemic really struck for me is how experiences varied widely depending upon who the governor was in each city or state, and who mayors were. So Toledo is unique in its context because simply we had different governor and mayor than any other city. And those national, state, local leaders had immense impact during the pandemic. And I think we'll be able to see where those leaders did well and where those leaders did poorly, where those leaders had great impact. It's interesting. I like Toledo immensely. I've been here now almost 10 years. It's unbelievable to me. And it's a region that I did not anticipate I would grow to love as much as I do, but I do. And that is, I guess I'm not answering your question very well, but in its uniquenesses and in its simple commonality with everybody else. To me, Toledo is unique because we are formerly a city with immense money, and I'm talking turn of the century, 1900. And because of that, we have great cultural resources like the TMA, the zoo, other places, and yet we're a community that is, a former Rust Belt city that is remaking itself and is increasingly varied in religion and race. And because of that, I think this is a great space to do this research.
Actually, I think that was a really good answer in many ways. And I think some of the religious components of how we deal with the pandemic, until you just said that, I'm not sure I've ever heard anyone talk about those issues. And certainly our public transit infrastructure, especially for people that do not have automobiles and people that cannot drive and have to depend on that, became extraordinarily crucial during the pandemic, and also extraordinarily dangerous in some ways. So that's a great answer. Now you got me thinking about all sorts of interesting things. So I'll thank both of you, and I'll sort of sign off here and let Sam bring us to a close. But Monita and Kim, thanks very much.
Thank you
Thank
all.
you.
Thank you, Dan. On behalf on the University of Toledo Alumni Association, I wanted to especially thank both Kim and Monita for educating us on this important work and helping to provide us with an opportunity to understand the greater impact of COVID-19. As someone who was born and raised in Northwest Ohio in the Toledo area, I'm very appreciative of all your work and doing all of these great things for our Toledo community and our University of Toledo students. I also want to thank Dan for moderating today's conversation and remind all of our attendees that today's conversation was recorded. So we will be sending this link out to all of our Cal alumni friends and students. So please feel free to share this information and help us spread the word. I did drop a link in the chat box if you're interested in supporting this important work. Please visit that link to make a gift towards the College of Arts and Letters that will help both Kim and Monita fund this project and really do some great things over the course of the next couple of years. And with that, I do want to ask Kim and Monita, are you okay if we drop contact information in the chat box? Is there a way that our attendees and those that watch this on demand, if they have questions, who should they reach out to?
Either one of us.
One of us.
You're welcome to email in the chat box.
Absolutely.
Okay. Perfect. Well, I will drop that information in the chat box and we will share that information in the recording as well. So again, thank you everyone who joined us live, and those of you watching on demand, please reach out and ask questions, and we hope you'll consider joining this great project. Kim and Monita, thank you.
Thank you. Bye-bye.